Has cyanosis ever confused you? There's nothing to worry about. Cyanosis is just the bluish discoloration of skin or mucosa due to increased amount of deoxyhemoglobin of more than or equal to 5 gram percentage. It can also be due to abnormal hemoglobins. So cyanosis speaks nothing about the saturation or SpO2. It just speaks about the absolute amount of deoxyhemoglobin. It should be more than or equal to 5 gram percentage. So outright you know that anemic patient can be severely hypoxic and still have no cyanosis, while a polycythemia patient may not be having significant hypoxia and can still have cyanosis. Coming to the types of cyanosis, in central cyanosis you have decreased oxygen saturation. In peripheral cyanosis there is sluggish flow, so the oxygen saturation is normal, and due to sluggish flow there is more of oxygen extraction. In hemoglobin related cyanosis, it is the abnormal hemoglobins that make you look cyanosed. In pseudocyanosis, it's actually skin pigmentation. There is no increase in deoxyhemoglobin. Coming to the central cyanosis, you have the lips, tongue, and mucosa that are looking blue, so also your extremities. The common causes are cardiovascular causes, congenital acyanotic heart disease with Eisenmenger, or congenital cyanotic heart disease. It can also be due to respiratory causes like severe pneumonia, ARDS, and COPD. It can be due to hypoventilation, it can be due to high altitude. Usually you have warmth in the extremities. In respiratory causes you have bounding pulses. And in addition, there might be some improvement with oxygen, except in the varieties where the cause of cyanosis is the cardiac shunting or shunting of blood. Coming to peripheral cyanosis, it is due to sluggish flow. The oxygen saturation is often maintained. The extremities are usually cold, and only the skin or the fingers and the nail beds are blue, while the tongue is pink. It is usually due to cardiac failure, hypotension, POVD or peripheral occlusive vascular disease, and exposure to cold. Differential cyanosis, you have cyanosis of the lower limb, while the upper limb is pink. In reverse differential cyanosis, you have upper limb that is more cyanosed compared to the lower limb. The classical example of differential cyanosis is a PDA with an Eisenmenger, while the classical cause of reversed differential cyanosis is a transposition delta arteries with a PDA and a pulmonary hypertension. Coming to hemoglobin-related cyanosis, usually methemoglobin and sulfamethemoglobin produces bluish discoloration or chocolate discoloration of the skin. They have normal saturations and their cyanosis don't improve with oxygen. Coming to pseudocyanosis, it is often due to skin pigmentation and not due to abnormal increase in deoxyhemoglobin. The conditions that are associated with chronic amiodarone use are diarrhea, heavy metal poisonings, and long-term minocycline use. So the basic take-home message is, if you have a pink tongue, you don't have a central cyanosis. If you have a cyanosed tongue, it could be due to central cyanosis or it could be due to abnormal hemoglobins. If your cyanosis improve with oxygen, it's most likely peripheral cyanosis, but some uncommon causes of central cyanosis can also improve with oxygen, except the shunting varieties.